My recollection is that the discomfort in your neck and shoulder was the biggest issue that you were dealing with.
Right.
Am I right about that?
Correct.
Can you talk a little bit about that, what it was like?
The pain in my shoulder is pretty significant, being that I have the baby. When I try to hold him or anything, the pain would really start to focus here, and some days it would feel like almost like I couldn't even hold him. It was just too overbearing. It would feel like my bra straps were too tight on me, like they were pressing down and kind of digging in. And then at times I would get a really sharp pain in my back if this pain was getting this significant. But it seems like I have a tremendous amount of pain in my shoulders and on my neck.
And if we could quantify that pain and establish a number between 1 and 10, with 10 being the worst pain you could possibly imagine, 1 being just barely noticeable, what number would you put on that pain?
8.
An 8?
Yeah, it's a significant amount of pain.
So it's really disturbing your quality of life.
Yeah, I can't move either way, left or right, without it being a significant click. And if you could open my mouth at all to chew, to drink anything, if you open, sometimes it feels like it was going to get stuck, and my jaw would get stuck.
You have had your OSB orthotic in your mouth for about, what?
Not quite 3 hours.
Tell me about your neck and shoulders.
I can still feel a little bit of pain in my shoulders, but it's not as bad. I've been really focusing on this the last couple of hours. The pain has gone from, like I said, like an 8. It's down to about a 4 now. And it's not something that's right there on my mind. Like as soon as I'm walking, I mean, I always felt this pain. I don't feel like my bra is tight at all now. I don't feel like there's this weighing down, like it's tugging down at me. It's not noticeable that it's there. Before it was like, wow. But now it's not as painful.
You were having a hard time breathing through your nose.
Yeah, even probably 40 minutes before we did this, I tried to eat lunch, and my nose was so stopped up that because I can't open my mouth to chew, it was so hard to breathe and to eat because I needed that air. And as soon as I put this in, within probably 15 minutes, my nose had cleared up, and I was sniffing around, and it was like, wow, I can breathe. There wasn't anything in there. I mean, I could breathe through my nose. I could close my mouth and breathe through my nose.
Before, you were able to turn your head pretty well from side to side.
Right.
Really, it wasn't a big deal.
Right.
But now you can turn your head farther.
Mm-hmm.
Can you describe how it feels now when you're going from side to side?
It seems like I have a better view of things whenever I turn from side to side now than what I did before. It was like a limited view. I could only see like a side view, but now I can see more behind me.
So your head is rotating more.
Yes.
You have this in your mouth right now.
Mm-hmm.
So it doesn't appear that your speech has been altered in any way.